Today I'm going to show you how you can hand express your colostrum from birth using my knitted boob here. So sometimes women might want to express their milk when the baby's born if they're having any problems with latching on, a baby's not feeding properly, or perhaps there's a tongue tie, or even prior to giving birth if you have looked into colostrum harvesting. The first thing you need to do is to make sure that you are sitting comfortably and that you've got clean hands as well. To collect your colostrum, which only comes out in a few small drops, you will probably need something like this, which is a little syringe. If you are giving birth in a hospital, ask your midwife or your nurse for some sterile syringes to do this. So when we look at the breast, you have the areola, which is the dark area around the nipple, and then obviously you have your nipple there. So what you need to do is you need to get your thumb and your forefinger into a C shape like this. And you need to place your thumb and your finger outside the areola, probably about 1/2 centimetre either side. And then what we need to do is we need to push back first. So you push back into the breast gently. You don't want to hurt yourself. So you push back into the breast and then you bring your thumb and your forefinger together and you hold it there. Now what you might find is that when you do this the first time, nothing much happens, especially if you've only just given birth or it's a day or so since you've had your baby, which is absolutely fine because colostrum is produced in very, very small quantities. Each time your baby feeds, your baby's probably only going to get a couple of mils worth of colostrum, which is absolutely fine because their stomachs are so tiny in the beginning. So once you've pushed back and you've pushed down, you hold it there for a few seconds and then you release and you do it again. So thumb, forefinger, outside of the areola, push back and push down. And you keep doing that until some drops start to appear. So it might take a little bit of practice to get going. And once you do start seeing some drops of colostrum appear, it might appear yellow, it could be clear, sometimes it's white. It's usually yellow though. But once you start seeing drops appear, then you might want to pick up your syringe and literally pop the syringe on the side of the nipple where the drops are coming out. And you might want to practice with this first before you actually do it. And then just draw back each time a drop comes out. So squeeze, collect a drop and draw back. Squeeze, collect a drop and draw back. You might not want to do it into a syringe. You might have a sterile cup that the hospital provides for you to do it in, which is absolutely fine, whatever way is easiest for you. You might want to get your partner, your birthing partner, to help you as well, which means that you can actually be expressing the milk from your breast and perhaps your birthing partner or whoever's with you can help you collect it in the syringe. So once again, that's thumb, forefinger on the outside of the areola, press back into your chest and then press down and keep doing that back and down action until you start getting some drops of colostrum. You'll probably find that you might only get 1/2 mil to begin with. You might not get anything to begin with, but that's okay. You just try again after a couple of hours. There's no problem at all. You might find you get 1/2 mil. You might find that you get 1 mil. You might even find that you get 5 mils or more. Everybody is different. But the key to success with hand expressing colostrum is to keep going and keep trying. Once you've managed to get as many drops as possible on one breast, then you then switch to the other breast and then you would repeat the process once again. So thanks for watching my video on how to hand express. Please do subscribe and watch out for future videos on all aspects of pregnancy, birth and beyond.